session. Here we go. Just so that we have this in case we need to refer to it at a later time. I am Jerron Robinson. I am one of the training specialists here at Maximus. My friend and beloved co-facilitator, Jamie Cyndia, you may or may not hear from her. However, you more than likely will see her along with another person, John Wolf. You may see their name pop up as far as answering any questions that you may put either in our chat or Q&A format. You may see that. I do see that there is a hand raised. Let me go ahead. It says our busy bone. Let me go ahead and give you, I went on ahead and allowed you to speak. Feel free to go ahead and unmute yourself. That way you can ask your question. Okay, looks like the hand was taken down. And again, that could have been an accident. I am going to show you guys all of the Zoom tools here in just a moment. If that was an accident, don't worry about it. Again, as I was saying, I'll be facilitating this session this afternoon, but Jamie as well as John, you may see them respond to some of your questions online. Oh, no worries. Busy Bone said, I apologize. You're good. Speaking of the Zoom tools, let's go ahead and take a quick look at that. We realize that some of you may be joining, and this is your first Zoom session or webinar that you've taken part in. Some of you may be pros at this, and so this may be new, a repeat of information or things that you already know. But we'll go ahead and get into these icons that you're going to see at the bottom of the screen. That first one being the audio settings box. Now, when you decide that you need to, for whatever reason, maybe because your audio isn't working and you can't hear, or if you're trying to speak and maybe the computer microphone isn't picking up, so we can't hear you, this gives you different options for speakers as well as microphones. The most practical way, especially if you're using Zoom on a computer and you're using the actual Zoom application, the most practical way is going to be simply letting your computer handle a lot of the audio. If you have some sort of a headset or you can hear that computer's volume. Otherwise, you are able to switch it if you need to your phone. And you can dial in from your phone if you're just using your phone and the Zoom application on your phone, that is fine as well. Many of these other options at the bottom of the screen should also be available to you. But if for whatever reason you need to switch it to the phone, you're able to do so and call either from your cell phone or even have the system call you. I want to call your attention to the chat icon. The chat icon, what we're going to mostly use that for any comments or messages that you guys may have, especially if it's not related specifically to the material that we're talking about in this session. We do have a separate place altogether for questions and the answers to those questions, and it really keeps the question and answer together. So we would rather you use that other section, which I'll identify here momentarily, for specific questions and answers. If you want to make a comment, add something to maybe something that's been said, that's where you would want to use the chat functionality. You can send messages to the host and panelists where Jamie, John, and myself will be able to read and respond to those. You can also click the drop down and send it so that everyone can see those messages as well. Depending upon what it is that you want to say, you can hit that drop down and make those choices accordingly. Next to the chat, It's going to be the raised hand feature. We accidentally stumbled onto that when we began our session. But if you do need to ask a question, you'd much rather not type it out. You're one that wants to just speak it into existence and let everyone hear. That's perfectly fine. Just raise your hand. That will let us know. It's going to notify to the panelists that a hand has been raised, and we can give you permission at that point to unmute yourself. Ask your question. We'll respond. Hopefully, we've got the answer, and then move forward. And you would be able at that point, once your question has been answered, to lower your hand. If for whatever reason you forget to lower your hand, don't worry about it. We do have the capability of lowering hands on our end as well. That brings us to our Q&A panel. Now, the Q&A box is really where we want to go to ask specific questions related to today's session regarding new enrollment. If you have questions about any of the P&M stuff that we're going to discuss, if you have questions about any of the changes, that's where we really want you to target those questions, because it's really easy for us to respond to the question, as well as we're able to go back into the system, get a nice spreadsheet of those questions and answers, and we are compiling additional resources and materials that will be made available to you all based off of your questions, not only from today's session, but from previous and of course future sessions as well. So it really helps us to capture that information, and it keeps the question and answer together. Here's an example. Maybe your question is, how do I locate the menu? So you type it out, you hit send, and then John wants to let you know that the menu is on the top left corner of the page. And you can see how no matter what, because there could be times where maybe that question isn't answered immediately. You know, it says 8:47, but maybe the response to that question isn't until 8:50. If we were to put that information in the chat, and then there would be additional messages that would come in between the question until whenever someone was able to answer it, sometimes it's a little difficult to kind of go back to see that this is the question that response is for. But when you put it all in this Q&A panel, it makes it really easy because it automatically keeps the question and answer together. You're able to not only view all questions, if maybe you asked a few and you just want to look at the questions that you asked, you're able to do so by clicking on that My Questions tab. But you can see all questions as well as the answers to those questions. The next one is the live transcript. If you are one that it helps you being able to read subtitles at the bottom of the page, this is where you click to enable that as well as disable it. Maybe you turned it on and then you're like, hey, I don't want that. You can turn it off by just clicking that again. Next, we've got these reactions. This reactions panel, when you click it, it actually opens up. It's kind of like a drop down that'll give you access to these 6 reactions or emojis. Occasionally, and I see someone's already using it, giving me a congratulations. We appreciate that. Occasionally, we'll even ask for you to give us some sort of a reaction. Someone's laughing. Okay, that's good. I see we know how to use the reactions. And that really helps us to know that you're able to see what I see. I might say, hey, throw up an emoji if you can see my screen. So if I don't get any emojis, then I know something's off. Okay, I'm not showing something. I need to fix something on my end. The thumbs up, you know, all of those are good responses. No sad faces over here. And then lastly, when today's session is over, again, you do not have to wait for us to end the session or for me to end the session. If you need to leave out prior to the session being over, or if we just finished and you're ready to leave the webinar, the far right bottom hand corner is the leave button. So quickly before we get into our agenda, go ahead and give me a reaction. Any one of those emojis just letting me know that you're comfortable with the Zoom tools as I've laid them out. Awesome. I see a lot of hearts. Congrats, thumbs up. You guys are great. I thought I saw a hand, but then maybe it disappeared. Person just wanted to make sure it was working. It worked. I saw it. If you do have a question, please don't hesitate to raise your hand, or again, use the chat where we can see it. Well, all right, let me move this out of the way. Here we go. Let's go ahead and get into our agenda, guys. So this course is designed, again, to deliver a detailed process for completing a new provider application. This is for enrollment in the new system, so the P&M or Provider Network Management System. Again, this is the system that will take the place of the systems that you guys are currently using today for these same functions. And this will go live on October the 1st. So today, what we're going to do is I'm going to walk you through all of the steps for how to actually process that enrollment of that application, rather, in this new system. So we'll look at creating a new application. We're also going to go through detailing all of the pages one by one from beginning to end that you're going to see. Of course, I will also walk you through the actual submitting of that application. What happens should the application be returned for any particular reason, and how you can see and be notified of that return, as well as submitting the additional information and resubmitting the application. Periodically throughout today, not only will we be looking at the slideshow deck, but I will be showing you exactly what this looks like in the actual P&M system. So we do have a couple of demos that are spread out sporadically throughout today's session. And then finally, we will summarize everything that we've covered in the session today, as well as open up the floor for any additional questions that may or may not have been addressed already, as well as if we need to just clarify something, opening up the floor for that as well. So let's go ahead and begin. We'll start off with actually creating a new application in P&M. So if you've taken part in our sign on and setup session that we have, then this will probably look a little familiar to you. I don't want to assume that everyone on the call has done that, so I am going to treat today as if this is very, very new and foreign to you all. But I do want to go over what you see on what we refer to as the home page, also known as the dashboard. Right here in the top left-hand corner, you're going to see the menu button. Okay, and that menu, when you click on those three lines, you're going to get a sidebar that's actually going to give you several different topics, a couple of different ways to search for providers in our provider directory. There's learning resources. There's a section there where you can contact, well, not contact, but where you can see contact phone numbers for various entities that you may need to refer to at some point in time. So all of that is going to be in that menu. Select provider. That button allows you to move providers to your Ohio ID account that match your existing email account. We've got pending agent requests. That button allows you to approve agent requests for access to functions such as submitting claims, running reports. So that's where you go when your agent needs access. That's how you grant the access to their requests as they've submitted them. Then there's also the account administration, but that's actually where you would go to set up agents. You can add their access levels in there, as well as transfer provider administrator roles to someone else that might need to be the admin. Maybe the initial admin is leaving the company. Maybe they're going on some sort of leave. So that is where you would go to actually switch that role to someone else that will serve as the account administrator. And then finally, and maybe for today's session, most importantly, the button that we're going to look at is the new provider button. This is where you go to start a new enrollment application, okay, for any new Ohio Medicaid provider that you're going to be administering. So they're not already enrolled. This is where you're going to go to initiate that enrollment process. You're going to click on new provider, and then you're going to get this screen here to create a new application. Now, you're going to see that the box that's highlighted is under standard application. More often than not, that'll probably be what you guys will use. However, if you don't need to enroll someone, you just need to do any of these other things, then you would just simply click on the select box underneath whatever it is that you needed to do. I also want to call to your attention that you do have 10 days to complete the application. Things happen. Maybe you started on a Monday and you don't finish it. You take a couple days, you forget about it. Maybe you didn't forget, but you needed to acquire some additional information that needed to be put into the application. And it's taken a couple of days to get that information. You do have 10 days from your initial start date of that application, and that's 10 calendar days, to go back in, finish it, get it all submitted. Otherwise, you would just essentially have to restart the process. Of course, for the purpose of today's session, we're going to just say that we're starting a new enrollment for a provider. And so we're going to hit standard application. And then because this is for groups and organizations, we would choose either one of those. Once you click on that from the provider type section, it is going to take you into the first kind of space where you can actually go ahead and input in some information. So you'll notice, as you're probably familiar with any other digital form that you've ever had to fill out, you'll see these asterisks. And of course, that just simply means that those are sections in which you have to fill it out. You can't skip any of the sections that have those asterisks. If you're requesting retro coverage, anything needing to be retroacted, then you would click that box. Of course, there is no asterisk because that might not be something that you need to check. But for everything that you have to check, it is going to, or have to fill out information, you will see the asterisk. You'll put in the tax ID, the NPI number. Now, what's going to happen is we're going to match that up in the system with the NPES registry database. So we will be, the system rather, will be checking that database or checking the NPI number against that database. If for any reason there's a discrepancy numerically, you are going to see this listed, this pop-up in red is going to appear on the screen, letting you know that that NPI number is not on the NPES list. So what you would have to do at that point is to get that updated, make sure that the correct information is on the list, or maybe if the information that was being input is wrong, then you'd want to make sure obviously that that information is correct. Now, once you hit save, after all of that has been put into the system, and of course, provided that all of the information is accurate, you are going to get a new field that pops up for taxonomy. So that field was not there before you hit save the first time. It shows up once you've hit save that first time. You can click the drop down and select the from the taxonomies listed. Based upon that, provider is going to determine if they have just the one taxonomy, if they have multiple taxonomies. Once you've got everything input and you feel that the screen is accurate, then you will hit save, and that will actually take you into the application. Once you get into the application, this is what you're going to see at the very top. So you've got this navigational kind of bar that runs across the top. You'll notice here under in the provider information section, there's a green check mark. For each of these pages, as you save them, you will see that that page now has a green check mark. Also want to call your attention to this highlighted section as well. That highlighted section is the page that you are actively working on. So if it's highlighted, that lets you know you are on the primary contact information page. Again, you will see asterisks, in this case, red asterisks, that let you know that that particular page is one that is required to be completed. You will also, at the top of that toolbar, see a jump to toggle where you can hit that drop down and it will show you the names of each sections of all of the pages. And then if you need to jump to a particular page, you're able to do so there. It's also going to show you, when you click that drop down, a green check next to all of the pages that you have already completed. So there's a couple of different ways that you can navigate once you're in the application. Finally, on this page, I want to call your attention to these buttons that you are essentially going to see on every single page. The first one is going to be this save button that saves the current page, but you don't advance to the next one. So you just save it and you stay on the same page that you were on. Cancel is going to clear the work that you put in. So anything that you already typed on that page, it's going to clear it, and then it won't save the page. Previous is going to take you to the previous page. And then this button here, this next button, is going to do what save does. It saves the current page, but it actually also advances you to the next page of the application. So more often than not, you may find yourself, instead of hitting save, hitting next, because again, that's just going to save it and take you to the next page. Lastly, there is this generate PDF button, which you may or may not use. It's really going to be dependent upon your preference. But if you do decide that you want maybe to save a copy of this application as a PDF file, that's what that generate PDF button will do. So in case you need to have it for your records, you would do that. Obviously, you would do that once you've completed the application. But you could save it onto your computer and be able to refer back to it later. Now, I mentioned a couple of minutes ago that sometimes things happen. Maybe you have to go to lunch, you're done for the day, you started an application, you don't feel like finishing it, you got some time, or whatever, Okay. If you ever need to go back to continue an application that you've started, but you just haven't finished yet, that option is available. Okay. From your dashboard, you will see that provider along with their Reg ID. Anytime you see anything underlined in P&M, you'll go ahead and know that that is a hyperlink that you can click. So you would click on either the Reg ID hyperlink or even the provider name. We also know that this is an application that has not been submitted because of the status right here. Okay, it'll say not submitted. And we know it's not submitted. We just started it. We just haven't finished it. So we need to go back in. So what you'll have, what you'll do is you will go in by clicking on one of those hyperlinks, and then under the enrollment actions spot there, you will click and expand that section, and then hit continue registration. What that's going to do is that is going to take you back into your application in P&M. And not only does it take you back into the application, but it takes you where you left off. So it takes you to the exact page where you left off at. All right. What questions do you guys have in regards to just this information of actually getting logged in and beginning the enrollment process? Let's see. Will BCBAs be able to apply for Medicaid number online now? Will they need to continue to submit paper applicant? I'm not actually sure on that. Let me reach out, get some information, and then I can respond to that. One second here. Okay, so I've got someone working on behind the scenes so that we can get an answer to that question. Are there any additional questions outside of that? Okay, what I want to do is I actually want to walk you guys through P&M just briefly on the sections that I covered, just to show you that it does look exactly like you're seeing in the slide, or at least mostly exactly. So I'm going to go ahead and log in. Now, when I hit next, it's going to do something different from what you guys um, will see. Yours will, of course, take you to the IOP, where you'll have to put in your Ohio ID login credentials. And then once you're logged in through Ohio ID, it's going to have you be redirected to P&M. For me, it's not going to do that. When I hit next, it just wants my password. I don't have to sign up through the IOP. So I will just go ahead and put in my password, but it is going to take you to the same place. When you guys get redirected from the Ohio ID website back to P&M, you're going to see this screen. So it's the same exact screen. You'll, of course, read those terms. You'll click that you've read it. And then it is going to take you eventually, because P&M tends to do things on its own accord and in its own timing. But eventually, there we go. See, I knew it was just messing with me. Eventually, it'll take you to the dashboard. So what I want to do is walk you through how it's going to look like when you have a new provider that you have to enroll. So I'm going to go over here and click new provider. Standard application. Again, because we're dealing with groups and organizations in today's sessions, I'm just going to choose a group. I'll click provider, I'm sorry, professional medical group. I've got my provider over here. Let me put that information in. Let me put in their NPI number and tax ID. We'll say that it's for today's date. We'll put in our zip code along with our zip code extension. We're not requesting retro coverage, so we don't need to click that box. And then you'll just hit save. Now, again, there was no taxonomy field that was there before. It does not show up until you hit save the first time, and you'll even see in red, now we have this that was not there as well, where it's letting you know that the taxonomy is required. I'll go ahead and hit the drop down and then hit save. And this will bring you up to the actual application itself. Again, just a callback to what we looked at in our presentation. Here is the screen that you're on because it's highlighted. So we are on the provider information screen. You can click the scroll bar and it shows you all of the other sections that will ultimately need to be filled out and completed. Again, you can see the red asterisks next to the required sections. Go ahead and just put some information in here. Again, we've got our save, we've got our next. I'll go ahead and hit next so that it can advance me to the next screen. And then notice how we've got that green check right there. Also want to bring your attention over to this jump to menu. When you click it, you will get the drop down. It'll let you know that you've got a total of 19 pages to get through. But it's going to give you a green check on every page that you've completed. If for any reason you need to jump to another page, you can do so. Keep in mind that the way that the application flows, it's just best, in my opinion, just to follow the happy path and just to let P&M kind of push you forward to the next page. Any questions additionally on starting a new application to enroll a provider? Let me just double check our Q&A. Oh, there's a question to the answer. Board certified. Okay, so will BCBAs or board certified behavioral analysts be able to apply for a Medicaid number online now, or will they need to continue to submit paper applications? And then the response to that is they will have to submit any new application into P&M after October 1st. Paper is being done away with in general. The provider type 53 is an application option. So it should be able to be done in P&M. All right, so we've walked through a display of what you see as we demoed how to click new provider and begin the enrollment process. Let's continue looking at some of these application pages as they will appear as you kind of progress through the application. That first page is going to be the provider information. We just actually looked at this. You would complete it as follows, of course, making sure to input everything that has an asterisk and to make sure that those fields are complete. Some of the information that's entered in previous pages does get carried over, so keep that in mind. Once you've got all of the information put in, whether that's the practice type or the ownership type, Once you're done, you would just simply hit next, and that is going to take you over to the next page. The next page is the primary contact information. That was that last page that we ended on before we came back to the presentation. This is where you're going to put in all of that primary contact information: name, address, phone number, email. You'll put all of that information in. Now it's going to, of course, let you know with these asterisks which fields have to be completed. But as we move quickly through things, sometimes we overlook, not paying attention. But the great thing about P&M is it won't let you forget something that's required. If for whatever reason you accidentally forget to put in, say, the email address, it's going to let you know. Okay, any of those fields, if you were to try to hit save or hit next and those fields are not completed, it is going to let you know with that red pop-up when you try to hit save or next. One thing that you're going to see on pretty much all of the address pages, because there are multiple, is you are going to get a USPS pop-up. Okay, anytime you're inputting an address, what we will do is, or what P&M will do rather, is we'll search the USPS system pretty much to just validate the address that you put in. And it may change something very, very simple. You may have typed out road, but the system has it as RD. You may have typed out drive, but the system has it as DR. Maybe you've got the wrong last 4 digits of the zip code, the extension. It doesn't matter what the new address is that populates. You always want to make sure that you hit accept. And then when you hit accept, it's going to update the address on that page. It's going to change it from drive to DR, or it's going to capitalize it. I've noticed that it capitalizes everything as well. Now, hitting accept only accepts the address. It does not save that information on your application. So what'll happen is you'll type the address in, you'll hit next, and this USPS pop-up is going to show. You'll hit accept, it'll update the address on that page, and then you'll have to hit save or hit next again to get progressed or to advance to the next page. And that's going to be the case on all of your address pages. This first address page is the primary service address. Of course, what you're going to do is to take note that this is a required section. It's going to let you know in red. You'll, of course, want to complete anything, any of those fields that have an asterisk. This is also a page that has some additional information towards the bottom underneath email address that you may or may not want to fill out. So located below that email address, you can add some additional details about that practice location. It's optional. You don't have to put in any of this information, but you can. You can also, in this spot here, choose to opt out of being in the public-facing provider directory once that gets added to P&M. But this is where you can put your hours of operation for the provider, the website. You can put in any of the patient information for who they are or are not accepting right now. You're able to do all of that on this primary service address page. Once you got everything put in the way you want it, you're able to go ahead and hit next, which will save that information, and it will advance you to the next page. The next page in this case is going to be billing and payment address. Now, this is the first address section that you have to complete where you can use the previous information if that information is the same. So for example, if the service location and the billing and payment address, if those addresses are the same, or if this is the same as the practice location address, instead of you typing in all of that information, you can just simply hit this check box. You can just check this box right here. What's going to happen if you click the checkbox is it's going to take all of that information from the primary service location or from the practice location, and it's just going to transfer it over to this screen. It's just going to save you some time on typing it. Of course, you can only use it if the addresses are the same. If for whatever reason the billing and payment address is different from the service location, then of course you wouldn't want to click that box. You would just simply have to type in that information. Keep in mind that when you hit next, once you've got the address information put in, you are going to get that USPS pop-up. You'll want to, of course, accept that and then hit next again to go to the next page. The next page in this case is correspondence address. Same thing is going to apply here. If the correspondence address is the same as the primary service location or is the same as the practice location, go ahead and click that box because it will move that information over for you, saving you some time from having to type it in. Once you got it put in, of course, make sure that you hit the accept on the USPS box that pops up. And then, of course, hit next again. There is a question in the chat. Can the admin of the group enter the service address and billing information for the provider if the provider begins the application themselves, or does the admin have to do the entire application? That's a great question. Whoever is going to be the admin for the provider is going to be the one that's going to have to complete the application. There is only one admin per NPI number and Medicaid ID. So you can't have multiple people that'll be able to start and resume the application. Hopefully that answers that question. Let's continue on. Once you're done with the correspondence address, the next one is going to give you the opportunity to add any additional service locations that you guys might have that are billed under the same Medicaid ID. You'll notice that it's not a required section. If you need to skip it, you just hit next because maybe you don't have any additional service locations. But if you do, then you would just simply hit add new. When you hit add new, you're going to get another box that's going to pop up, which is going to give you a means to put in all of that information, including any of those additional details about that other service location. Again, maybe they've got different hours of operation at the other service location than at the primary service location. Along with being able to opt out of the public-facing provider directory for these other service locations if you so choose. Let's see, next, we've got the 1099 address. Same thing is going to apply here as the arrow shows. If the 1099 address is the same as the primary service location, then you would just simply click that box. It'll pull over all of the address information. And you would still need to complete the IRS and the tax questions towards the bottom. But as far as the address is concerned, it'll actually pull all of that over if you click the box. Of course, if you can't click the box because the addresses don't match, you just simply have to type the information in. Of course, once you hit next, you'll get that USPS pop-up. Make sure you hit accept and then hit next again to go to the next page. In this case, this is our final home or our final address section. This is the home office address. Again, if it's different than the practice location, you have to manually fill it out. If it's the same, then you would just simply click that box, and then it's going to pull that information over. Once you got it all put in, go ahead and hit next, making sure that you accept the USPS pop-up and then hitting next again to go to the next page. All right. What questions do you guys have? Let's see, do we have any questions? Do all the service locations need to be listed under a provider for payment? I don't know that they all need to be listed for payment. If the service is being provided at that location, you'll certainly want to add it in. I don't know if that means that they, in order for you to get paid, I mean, and we can certainly do some additional digging around to get a more concrete response for that for you. But I don't believe that you will unless you don't have the one for the actual service location where the services were rendered. Again, I'm kind of speculating. What I'll do is I'll reach out to see if we can get an additional response that's a little bit more solid for you. Any additional questions? Okay, looks like someone's working on that. Okay, so Jamie's response: the service location will be more so for the public-facing provider directory. Payment will be taken care of on another application page. Thank you, Jamie. All right, let's go ahead and pull up P&M. Give me just one moment. Because I want to take a moment again just to walk you through some of the slides that we just looked at, specifically the ones for the addresses. I know that there's a lot of those. So let me go ahead and pull up a provider application that I've already initiated, and I can show you how you actually go back in to continue the application. Once you've got logged in, again, we see that these are underlined. You've got the registration ID, you've got the provider. It doesn't matter which one you choose. They will both take you to the exact same place, which is going to be where you can manage that provider. This is the provider management home. In order to continue an application, you want to click the drop down next to enrollment action selections. And then we want to choose this one for continue registration. All right, so again, for the sake of this demonstration, we have already completed provider information and provider contact information. And we know this because of the green checks. We also know that we are on the primary service address page. It says it right here. This is highlighted yellow. Again, if you were to click the drop down, it's going to show you that we have indeed completed provider information and primary contact information. So let me go ahead and input some information. See that it did pull my organization name over from what I had entered previously. And now I just have to go through the process of typing in the address. It did pull over my zip code my extension. I'm going to go ahead and type in the phone number and then the email. All of the spaces where they're required. But again, keep in mind there are several other spots down below the email address where it is not mandatory. It's not something that you have to do, but you can if you would like to. And then, of course, here is the provider directory opt-out button. We're just going to pretend that I completed that, or so that we can move forward. I'm going to go ahead and hit next, and you will see the USPS pop up here. It corrected everything as it saw fit, and now I need to hit next again. Let me fix something really quickly because otherwise it's going to bother me. I can see my slideshow on the screen. So I want to get rid of that really quickly. There we go. It was just bothering me. Sorry about that. All right. So here's the billing and payment address section. Again, this is where you can actually have P&M move the address over that you used in the primary service section. If it is the same, all you have to do is just click that box. What it's going to do is it's going to move all of that address information over, even including the phone number and email address, pretty much everything that has the asterisk. So you won't have to type anything. Once that address is in place, you'll go ahead and hit next, keeping in mind that you will still get that USPS pop-up. Go ahead and click accept and then hit next again. That's going to take you to the next page. You see how we're just moving through the pages. They've got those green checks. We'll click that. Of course, if it is the same, we'll hit next, hit accept, and then hit next again. If for whatever reason you needed to add in an additional service location, you are able to do so by clicking add new. But again, it's not a required section, so you don't have to. If you don't have an additional service location, you don't have to add one. But if you do, you would just click add new and then pretty much go through the exact same steps as before, even allowing you to input any of the additional optional provider information. Again, if you don't need to add anything, you can just simply hit next. As you can see, we are moving through all of these pages. Moving through all of these pages. Let me go ahead and go back into our presentation. Are there any questions on what we just looked at as far as completing those addresses, those address pages, before we continue on into the different sections of the application? Give me an emoji if you think that this is something that you guys would be able to perform so far. I see a heart. I see a couple hearts. Thumbs up. Awesome. Awesome, guys. That makes me feel great. You guys are the best. All right, let's keep going. Next thing we want to look at after you've input all of the address information is going to be specialties. That's going to be the next section that P&M is going to progress or advance your application to. Of course, this is a required section. What you'll do is you'll hit add new, and then in the drop down, you'll choose the specialty, and then you would hit either save if maybe you only have the one specialty to add. Well, I'm sorry. You would hit save maybe if you needed to add multiple. If you were just adding the one specialty, instead of hitting save, you could hit next, because again, next is going to save it and advance you to the next screen. If you do decide to hit save, even if you only have one, maybe you just forget to hit next and you hit save, you will see that that specialty has been added and is now a part of the application. If for any reason you need to edit it or update it, maybe you need to get rid of it and add another one, you're able to do so by clicking on that pencil and paper icon or that red X. Now, I do believe that the red X only shows up if there are multiple specialties already put in. Once you put in a specialty, you can't delete it to where there's no specialties at all, because again, there has to be a specialty listed. Once you've done with all of the specialties, the next screen is going to be the taxonomies screen. Now, this should automatically show up, because keep in mind, at the very beginning of the application, you already did this part. You already added in a taxonomy. But if for any reason you need to change the taxonomy or add a different one, you are able to do so, again, by utilizing that pencil and paper icon. Once you've got the taxonomy all added in and you're ready to go to the next page, of course, you would hit next, which is going to take you, in this case, to the professional licenses page. Now, this says that it's a required session. This is where you go to add a professional license. And you not only have to submit the information by manually typing it out after you hit add new, but you will also have to actually upload a copy of that license to the application. So you'll hit add new, you'll manually type out all of the information. Once you've typed out all of the information, again, the asterisks, those sections are required. Anything additionally is not a requirement. If you have that information, you certainly want to add it. The other thing that you'll have to do towards the bottom of this page is upload a copy of that document. So what will happen is you'll click browse. It's going to open up to your documents on your computer. You'll look or navigate to wherever you see that document. You'll click it and then hit open, or you can double click it. Either or works. And then what you'll see on the application is it's going to be in green. So it's going to let you know, hey, this license is now added. It is a part of the application. Once you've got it added to the application and you've completed that information that needed to be filled out, you just simply hit next, and it will save that page and then advance you to the next page of the application. In this case, the next page is Medicare number. Now, this is where you'll add either a Medicare number, a Medicaid number, or both, okay, that you might hold outside of Ohio. Let's say it's a Medicare number. You'll hit add new next to Medicare. It's going to open up, and you'll complete these sections, uploading any required documentation. Or if it's a Medicaid ID, or even if this is so, to receive that, you would hit add new next to Medicaid, and then of course complete all of that information. Now, your status might not be one that's complete. It might be pending, or it might be, I'm not sure, exactly all of the different ones that the options that appear in the dropdown. But this is where you would go to add that information. Again, you don't have to have both. It can be an either or. Once you've got it added, of course, you'll save that information by hitting next and then going to the next page. Next page is going to be group, organizations, and hospital affiliations. This is where you're going to start to input individual provider names that might be associated with that group by adding new, by clicking that add new button, putting in their information, including their name, NPI number, and rendering location. It's going to default to today for a start date. And then you would just simply hit save. Once you save that information, again, it always shows up on your application, letting you know that that information has been added. And then you're even also able to see that status, so of that individual provider. It might not say confirmed, it might say active, it might say pending removal. The status definitions that you'll see are at the bottom. Again, we are making these presentation decks available to you all through our learning management system as well. Once you've got all of those providers added, you've got that information on this page secure, you want to save it, go ahead and hit next. That's going to save and advance you to the next screen. This case, that is the MCP, or the Managed Care Plan affiliation page. And this is where you can indicate the provider's interest in contracting with any of these Ohio MCPs. If they are interested, they'll click yes. If they're not, they'll click no. This is not a required section to complete. You really only have to complete it if they are interested in any of the Ohio Medicaid MCPs or managed care plans. If you hit yes because they are interested, then these additional sections will show so that you can click or check off those boxes for the MCPs that the provider is interested in getting more information on, and those entities will contact or reach out to those providers. Of course, once you've completed this section, you'll go ahead and hit next and save it so that you can go to the next page. Any questions? Looks like we've got a questionnaire. If a group is delegated with the managed care, should we click on the plans? Again, if you feel that they're going to want additional information in regards to them, then yes. If you're already affiliated and don't need additional information for it, then I don't believe that you would need to. Again, this is just so that you can initiate pretty much a contact from those listed MCPs that you may be interested in getting more information on. Again, as in regards to that second question, we are contracted with the MCP as a group and are adding a new provider. Would we click yes on the MCP page for credentialing purposes? Again, that particular page dictates the interest in that. So I would imagine so. If you aren't already in any sort of affiliation. I will allow as this session progresses, if there are additional responses to your answers, so that those can be input, and then I'll call out to those here as we continue to go along. So I do want to take a moment to go through and show you guys a little bit more of what you're going to see in P&M. I think I'm going to do a smoother transition this time. Let me stop that. There we go. That was a lot smoother. So we just walked through a series of pages, and I want to take a moment to show you what some of those pages look like here in P&M. So let me pull up this particular provider. And again, because we want to continue an application, we're going to click the drop down next to enrollment actions and click on continue registration or application. And we want to look at this specialties. So I have already completed all of these other address sections already. And now we're going to complete a few of these sections just so that you can see what they look like. Again, you see that because this is a required section that appears over in red, as well as you're going to always see that asterisk as well. In order to add a new specialty, we'll click Add New. This box here is going to pop up. We'll hit the drop down. We'll choose Professional Medical Group if that is the specialty to be chosen. And then if this is the only specialty and I do not want to add anything additionally, I can go ahead and click Next. It is going to save it and it's going to take me to the next page. But I just want to show you guys what it looks like if you do hit Save. So that way you can see that this particular specialty has been added. It is now part of the application. Now, if I want to add a new one, all I got to do is hit Add New, and then I'll just go through that same process. But for the sake of time, let's just say that this is the only specialty that we need to add. So I will go ahead and hit Next. Which is going to bring us to the taxonomy screen, just like in our presentation. Again, this is a required section. However, remember, you already put in taxonomy information at the beginning of the application. So it pulled that information over. If everything is correct as it appears on the screen, I can go ahead and hit Next and go to the next page. If for any reason I need to make changes, either add a new taxonomy, edit this one, I can click the pencil and paper. I can also click Add New to add an additional or to add another one. But again, we will just say that this is the only one that we need. So we'll go ahead and hit Next. This is not a required section, so I can just simply go ahead and skip it. It's saying here that this is also not a required section as well. Again, we can go ahead and skip it. And then one final thing that I wanted to show, actually, no, a couple of additional things that I wanted to show. Let me go ahead and add individual provider here. Give me 1 second. I want to move this to a different page. Sorry about that. One moment. So I can add a provider for you guys so that you can see how easy that is. All right, let's add Lindsay Aaron. And of course, you will have your provider's information, that being their NPI number. You'll click the drop down for rendering location and then hit save. It'll of course search for that provider, and then the affiliation status will be whatever that affiliation status is. It might not say member not found. It may say something else. Once you've got all of your providers added, you'll of course hit next, thereby taking you to the next page of the application. In this case, MCP affiliation. Again, this is not a required section. I don't have to choose it. If you want to, go ahead and let these entities know that you're interested. You would just simply click on the check boxes for those that you were interested in, and then of course hit next so that you can save it and then go to the next page. Now, I wanted to take a moment to show you guys, and this will be the final page that we'll look at in this demonstration, but I wanted to show you how you go about actually uploading documents. So you will get to sections, in this case, the W-9 section, where you will have to actually upload a copy of a document. So you will choose the correct categories based upon your tax affiliation status. You'll indicate the form that you're going to be uploading. It's going to let you know that it's a required document. You'll hit browse, and then you'll go to wherever it's located on your system, on your computer. Again, you can click it and hit open. You can just double click it. It's going to do the same thing, which is upload that document. And now it's in green and it has become a part of the application. So now all I need to do is either hit save or next. In this case, I'll just hit next. Of course, it's going to save it. And then it's going to take us to the next page in our application. Give me one moment. Let me go back and open it up for questions. Well, looks like there is a question. Jamie's responding to it. Make sure I haven't forgotten anything. Nope, we've covered all of that. All right. While she's answering that, I will continue, and then I will go back to it as we progress. Once you've gotten through that screen, guys, the next one is going to be the professional liability insurance section. Again, it lets you know that it is a required section to complete. So you will hit add new, and it is going to ask you if you carry that insurance. If no is selected, then you'll need to just simply provide an explanation regarding that. If yes is selected, then it will open up additional sections for you to complete. Of course, keeping in mind that the sections that have the asterisks are the ones that have to be completed. I see that a question has been answered. Can we add multiple rendering locations when adding a new provider to the group? The response to that, the group will have to list their location or locations. And then once the provider is associated to that group, it should show all the location for your group that the provider is affiliated with. Awesome. Thank you so much, Jamie. Once you've got all of that liability insurance information put in, you will of course hit next so that you can save it and then go to the next page, which is the W-9 form that we actually just looked at. You'll complete that. Of course, you'll choose or indicate the form that you're uploading and then upload that document. Again, by hitting browse, navigating to wherever it is on your computer, and then either double clicking it or just hitting open, you'll see it save because it shows it in green. Once you got it uploaded, go ahead and hit next. That's going to take you to this EFT banking information section. It says that it is a required section. That does not necessarily mean that you have to put in banking information, but it does mean that you have to answer that question. There is a question at the top that says, do you expect to receive payments directly from the state Medicaid program as opposed to only payments from the managed care contractors? If you hit no, you don't have to put in any additional details. If you put yes, you will have to go ahead and add in a banking information along with an EFT contact. When you click to add new next to banking information, it does open up a separate box, so to speak, where you can input all of that bank's routing, account number, all of that information, whether or not they're a checking or savings account, so on and so forth. Once that information has been added, just of course, make sure that you hit save, and then you'll see that information listed on that page of the application. Same thing is going to apply with the EFT contact. So their name, their phone number and email address, fax number if you want to add that if you have it. Again, once you've got that information put in, you'll just simply hit save, and you'll see that it is now a part of the application. Once you see that both of those have been added, you'll click the box at the bottom just to confirm the information provided. And of course, once you've got all of that information checked off and added, make sure you hit next so that you can save it and go to the next page. Next page is the application fee page. Again, this is a required page. Lets you know that all prospective re-enrolling and reactivating institutional providers required to pay an application fee. It can be paid directly through this page via credit card, or a waiver can be requested. If you know that you're going to have to actually pay that fee, then what you would do is you would click on the radio button that says credit card and then click on select payment. When you click on select payment, a new screen pops up for the e-payment CBOSS processing system. And you would just put in all of the information, person's name, the card number, expiration date, all of that information. Once all of that information has been put in, then you would just hit submit at the bottom. And then when you hit submit, this authorize payment, that button is now available for you to click. It was grayed out before you added the credit card information. So you'll click that authorize payment button to charge that application fee to that credit card. Once you've done that, you'll of course hit next and then advance to the next page. Now, if you are requesting a waiver, you would simply hit that request waiver of application fee radio button and then choose from the list in the drop down of the reason for the request to have it waived. You know, you already paid it in another state, or it's been paid in the past 5 years. You would get that information, or you would get that, choose whichever one, which reason was for you. Enter in any additional comments as necessary. and then of course upload a proof of that payment by doing the same exact thing that you did when you had to upload your license or when you had to upload the insurance information, so on and so forth, or the W-9. You would just navigate to your computer and then choose, in this case, whatever you have deemed is proof enough that you did go ahead and make that payment and the need for the fee to be waived. Once you've got that information all put in, of course, you're going to hit your favorite button, which is next, which is going to save that page and advance you to the next one. In this case, that is the owner information page. Now, this page is where you're going to actually go through each one of these drop downs. Now, not every single one of them is portions of the application that need to be completed, but they will, of course, have information in there, maybe some additional things that may need to be said, that the application wants you to read. But there are a couple of different sections that you'll have to complete. And this is where it just has information for the owner. So when you click on the owner, managing employee and controlling interest information drop down, that is the one where you're going to actually put in the name of those owners or that owner or any managing employees, or if there's anyone that has some sort of controlling interest. You're going to want to add in or add all of that individual's information or those individuals' information. This is also going to include maybe, their title, their percentage of ownership. You have to put in all of that information. But you can add multiple. You can add multiple. You would just save it and then hit add new to just keep adding names to the owners list or to that owner information section. There's also a separate expandable option for real estate owners, if there are any of those that need to be added. There's also some additional disclosures as well that you may need. If you meet any of these conditions, you'll have to disclose that you meet these conditions. That's why it's important to make sure that you expand each one of those expandable options. Again, not every one of them is going to be where you would actually have to fill out information, but some of them do. And if you don't expand them all, you may find yourself accidentally not putting in some information that needed to be disclosed. If you did have additional things to disclose, once you've got those all taken care of, and you've got, all of their information added, because you would have to put in the names of those additional individuals. But once you've got all of that added, of course, you would save it and then continue going to the next drop down or expandable option, still within that owner information section. I believe that the last one is the questions section, which you will be presented with a series of yes or no questions that you'll have to, of course, answer truthfully. Now, if you answer no to all of the questions, then that question really has been fully answered. But on the chance that you do have to answer a yes, then you will get an additional section kind of pop up right underneath that, where you can hit add new to add in that information. You would click add new, and then you would put the name of, who the person it is, or these are drop downs. And you would just hit those drop downs and then complete those sections with the information that pops up in the drop down. Once you got in all of the owner information, those sections are complete. Of course, feel free to hit next, which is going to save and then take you to the next page. This is still up. There we go. The next page is required documents. Now, this may or may not display as a required page. Sometimes depends on how you entered the application, the provider type, some of the boxes that may have been filled out can determine what required or optional documentation is going to be necessary. But you will see a required documents page, and you would just upload any required and or optional documents the exact same way as we've shown before. You'll want to click browse, navigate to wherever that document is on your computer, and then either double click or just click it and hit open, and it will display on the application in green, letting you know that it has been added. If for whatever reason you do have documents that cannot be uploaded, you can mail them, and the mailing address will appear in P&M. Of course, this can cause a delay in the processing of the application. But you shouldn't have, I mean, if the document is saved on your computer, the upload size limit is 10 megabytes, which should be plenty to get the document saved and added to the application. Once you've got it saved, you'll go ahead, of course, hit next, and that's going to take you to the next page, the application, which I believe is the final section, and that is the agreements section. When you see agreements, you're home free. Okay, you're home free. This is actually where you're going to complete the provider agreement attestation, as well as the signature, basically saying that you're holding yourself responsible to all of the information within the pages of this application. So I just kind of want to break it down, each one individually, as far as what you're going to see. You'll see the Ohio Medicaid provider agreement. There are multiple statements. Please make sure that you use the scroll bars on the right on each section to navigate. Once you get to where you can click that you agree to the terms and conditions, of course, you want to make sure that you check that box. As you continue to scroll down a little further, you will also see a provision check, depending upon if you're requesting retroactive agreements. If so, and you meet that provision, you can check the box. Otherwise, just leave it blank. Again, as you continue further down in the agreements section, you would definitely want to read all of the information in the provider agreement attestation box, making sure that you click that checkbox. And then finally, providing your electronic signature to complete the application. It would just simply be whoever's completing the application, they would put their name next to name of person attesting. The information next to provider name and user ID is going to actually autofill. And then you would simply click save, and that will essentially complete the application. All right, give me 1 second before. Okay, I was just wondering something. What questions do you guys have? You guys should give yourselves a round of applause because you have successfully completed an application, a new enrollment application in P&M. Now, I can only speak for myself. I feel like this is something that's user friendly enough that you can navigate through and be able to accomplish, provided, of course, that you have the information. If you've got all of the information to put in, I think that you guys will be able to do it. I do want to take a moment to walk through one final demonstration so that you can see also not only how you complete it, but how you submit it as well. So just give me one moment here. Let me go back out to one that I already have queued up. All right, so again, we're just gonna pretend that we've already completed all of those sections. I'm gonna click continue registration and show you guys where we're at in this application. So we've done everything and we are almost at the end. Okay, we've only got just a couple more sections to go. So I just want to show you what these last couple of sections look like. When you open up and go to this owner information, it typically, at least in this training environment, has instructions already opened up for you. But I did just want to show you that there are multiple sections. Again, the great thing about P&M on these required sections, you see how that says required, is that if for whatever reason, and I've actually done this, if for whatever reason you're just not paying close enough attention, you thought you filled everything out that was necessary, and for whatever reason you didn't, P&M won't let you uh, advance to the next screen. Like I can't hit next or save right now without completing these questions. I know I haven't completed them. So I just want to walk you guys through what that looks like. Typically, the instructions will already be expanded. It's just going to give you, all of the finite print material that you'll certainly want to read is going to be listed there. Definitions and requirements, I believe, just has a little bit of information. Owner, managing employee, and controlling interest information, that's where you'll want to begin inputting information. So I'm going to go ahead and hit add new. And then I'm just going to make up some stuff real quick. We'll say they're the vice president, controlling interest. Maybe it's me, who knows? I'm just going to use this address here in Columbus. It's thinking. There we go. Put in my zip code. We'll just say it's, well, no, not 1908. I mean, I guess that could be the case though. We'll make something up for this section here. And we'll just say that they have 100%. Then we'll just hit save. I can assure you that Jerron does not have 100% ownership in this provider's business. All right, so we'll hit save. It closed up owner, managing employee, and controlling interest information section. Real estate, you may not have any real estate owners. I'm not going to add any, but if you do, of course, you would hit add new and then proceed to adding them. Additional disclosure. I did want to open that up. What you'll want to do in this section is to simply read this. And if you meet any of these conditions, you'll have to add those parties' names in here. Okay, you'll have to add their information. We'll just, again, for the sake of time, say that we don't have anything additionally to disclose. Last but certainly not least, we do still have to click on this questions section. Again, these are all yes or no questions that you will just simply respond truthfully to. If you hit no on all of these questions, as you can see, nothing is happening. But if for any reason I have to put yes on any of these questions, a new section pops up where I can hit add new to address whatever I answered yes to. Hopefully it wasn't that I've been indicted or convicted of a violation of state or federal law. Let me hit no to that one. That just made me feel guilty for some reason in that moment. I assure you guys, I do not break laws. Of course, you'll go through and finish by hitting yes or no to the remaining questions. And then once you're done, of course, hitting, I didn't mean to scroll up, hitting next. Again, what next does is it saves it and then advances you to the next screen. If there were any documentation that you needed to add, it would be listed down here. It is saying for this particular provider type that I chose, there are no additional required documents that need to be added. But if I maybe wanted to upload documentation, I still have the capability of doing so in this section here. But if I don't need to add anything additionally, I can just simply bypass this by hitting next. This brings us to our final session or final section of the application, and that's the Medicaid provider agreement section. So in this section, again, what you'll want to do is to make sure that you use each individual section's scroll bar so that you can address anything that might need to be addressed, whether that's checking something off, in this case, the false statement agreement, making sure that I check that I agree to that, those terms and conditions, scrolling down further, additional numbered items, as well as a final I agree to these terms and conditions checkbox. There is that provision check. Again, letting you know certain provider agreements may be retroactive. If you meet that provision, feel free to check the box or just leave it unchecked. Scrolling down further to the provider agreement attestation portion, you'll of course read that and then click the checkbox stating that you agree. Before finally saving and signing rather with the electronic provider agreement signature. Now mine is going to look a little bit different. You see here, I've got this enter password field. Again, keep in mind when I log into P&M, I do it a little bit differently from you all. You will not have this password field. You will only have name of person attesting, provider name, and user ID. And as you can see, provider name and user ID have been filled out for you. I'm going to click this drop down, Jerron Robinson. I'm going to put my password in and then hit save. Now, when I hit save and when you hit save, it is going to look like this. We're going to get the same thing. Okay, it says your application is complete. It's been saved. Please take time to review your application prior to submission. You will be able to generate your completed application in PDF form prior to submitting it. Okay, all you're going to do is hit OK. And then you're going to see this submit for review button that is there. I'm not going to click it just yet. I want to go through the remaining pages of our presentation, but I wanted to kind of walk you through up to the point where you would submit. And then I'll go back here in just a moment and show you what that looks like. So let me go back. We've addressed questions. We've displayed P&M. Let's talk about what happens when you're ready to submit the application. Again, as we just saw, you'll get this box that pops up once you've completed all your agreements, and you'll hit OK. You'll see that all of your sections have that green check mark. If you click the drop down, you're going to see all of those sections have their check marks. At the top of the application, you are going to see a submit for review button. You'll also see this generate PDF button. Of course, if you do want a copy of the application in a PDF format for your records, make sure that you hit generate PDF and it'll save it to your computer for you. After you've gone through all of the pages, you're comfortable, you're confident with the information that you've put in, and you're ready to submit it, go ahead and hit this submit for review button. Once you do that, you're going to get a screen that pops up that simply says you have successfully submitted your application. And it lets you know that there are 10 days that you'll want to allow for processing before you attempt to submit any changes. When you click return to home page and you're back on your dashboard, you're also going to see that it has in fact been submitted with a submit date on the right-hand side. So before it would have said not submitted, but because we've gone through the process and submitted it, now we see that it has been submitted with a submit date. Again, for our final demonstration, I just want to take a quick moment, walk us back through the same application that we were on. Let me go out just for a moment so that you can see that it says here, not submitted. Okay. So now I'm all complete. I want to go through, continue the registration. Of course, I'm going to click that hyperlink that takes me into the provider management home and then expand and click the continue registration. It's going to pick up where we left off. Again, we're done. So we're going to hit OK. We can see here all of our sections have green checks. All of these sections in the jump to box have green checks. I'm ready to go. If I've double checked my information and I'm confident, I can go ahead and simply hit submit for review. P&M eventually, painstakingly, it's going to let us know that we've completed it. There we go. And then, of course, you can return to the home page. And then now it no longer says not submitted. Now it lets us know that it was submitted today. All right. What kind of questions do you guys have? Let me make sure that I'm not overlooking something. that was answered already. Don't see anything. All right, well, let's keep going. Oh, did I see something? All right, before we get out of here, got a couple of additional things I want to show you guys. Okay, so we've already walked through our display of P&M. We did that by looking at the applications once they've been submitted. Occasionally, guys, when you send a new application, you might get it back. Okay, it may be returned to you, and I want to kind of walk through briefly what that entails. Because this is a review process, sometimes an enrollment specialist, maybe a credentialing specialist, they might return the application because we need some additional information. What's going to happen is whoever is the primary contact on the application, they're going to get an email indicating that a notice on the account has been issued by the Ohio Department of Medicaid and that it may require you to act. And then you can see the details of whatever the information is or whatever that's needed. You can see that in P&M. You'll also, when you get logged into P&M, you'll see that the status is a little different. It's going to say return to provider. Remember before, the last thing maybe that you looked at or saw was submitted. But as it's gone through its review process, some additional information was needed. Maybe you sent over a document that had a blank page on it accidentally. And so we just need you to send us a new document. So it'll say return to provider. And all you have to do is to just click on one of those hyperlinks. When you click on the hyperlink, again, that's going to take you to that provider management section. Instead of hitting the enrollment action selections as you've seen me do, you'll actually want to hit the self-service selections box because that's where you go to view your correspondence. You'll click on that link for provider correspondence, and it's going to open up this box here. This is where you'll put in date ranges and search for the correspondence that you're looking for, or search for whatever it is that you're looking for based upon those dates. Once you hit search, you should get a result or results that pop up. And then you would simply click on whichever one of those that you needed to view. And upon doing that, it's going to open up this provider communication file. And in it is going to be a reason for the return in that email. So in this particular instance, it's saying that the NPI number and a taxonomy are not attached or are incomplete. You just need to verify that the NPI number and a taxonomy correspond. Once you've viewed that information, now you know, okay, this is what I need to now submit. You can just close it by hitting this red X over here. Then, of course, what you'll want to do is to update the application. So now we're going to click on the enrollment action selections drop down. And then we're going to, of course, continue registration because now we know what we need to add. Now we just have to go through the process of actually adding it. Once you click continue registration, you're going to see what you're used to seeing. You're going to see the application in P&M. Do want to call out a couple of new things, however. Instead of the green check, you're going to see a yellow exclamation point. That exclamation point is there to let you know that this is the page that needs additional information. You'll also see in red what may or may not be needed. In this case, it's saying, hey, proper paperwork not attached, license document uploaded, is a blank page. What you would do is you would make those proper updates or corrections to that page, and then you would click next, or you can click save. Upon clicking save or clicking next, you're actually going to see that it's now no longer has the yellow exclamation point. Now it's got a green check. So that just lets you know, hey, it used to have that yellow exclamation point. I updated everything. Now I need to resubmit it. And then everything else will be the same. You'll click OK, and then you will click submit for review. Because now your application has been updated with that additional information so that that additional information can be reviewed. Of course, once you go back to your dashboard by hitting return to home page, you're now going to see, instead of return to provider, that it says submitted, letting you know that you've taken the necessary steps to finish with the updated information. All right, guys, I know I've kept you for a really long time. I do want to just offer a final brief summary of everything that we've discussed today, as well as towards the end, open it up for any additional questions that you may have, as well as talk about how you can evaluate today's session. In summary, what we've done today is we've talked about how you, as an admin, can enroll new providers and create new applications for them for applying for Medicaid. You would, of course, click that new provider button in the top right corner to begin the application. As you navigate and progress through the applications, highlighted sections indicate the page that you're currently on. Green check marks indicate pages that are complete and there is no additional information that needs to be added. You can click save, but if you click next, that's actually going to save it along with advancing you to the next page. Once you've completed the application and saved it, you do still have an opportunity to review it before you hit submit for review. Of course, once you hit submit for review, your application is submitted and you will see that status on your dashboard. Now, periodically, you may want to look at the dashboard. You may see a different status for that application, okay? Sometimes that will be the case. But once you've clicked submit for review, it will say submitted. Occasionally, we do need some additional information. So we will send back that application. You're going to get a notification in PNM along with an email for you guys. What you'll do is you'll click on the hyperlink so that you can actually go back into the application. You'll review the provider communication after you searched for it. And then when it is time to update and fix or add whatever needs to be added, you'll of course click continue registration. Once you go back into the application, that page that needs updated will be highlighted, as well as there will be a yellow exclamation point. Once you've got that information edited, updated, you've added it in or fixed whatever was wrong, you'll of course hit save or hit next, and then hit submit for review. Finally, want to open it up for questions. Let me look in our question and answer panel. I don't see anything in here. Make sure I'm not overlooking anything. I actually see something here um, in the chat, just for confirmation. Oh, it looks like this was just sent to the panelists, so you guys may not be able to see this. If the provider obtains a Medicare number, that allows for proof to be submitted of the Medicare number, which waives the processing fee. You're more than welcome if that suffices as proof. I don't know what suffices as proof. You're more than welcome to submit that over. If for whatever reason it isn't proof enough, then it of course that application will get back to you. But let me see if I can get a more firm response to that here in just a moment. While we're working on that, I want to say thank you to you guys for spending this afternoon with us, taking a couple of hours out of your day to hopefully learn some of this information along with us. Hopefully, you have, this has been informative. We do want to call your attention to a place where you can actually evaluate the course. I will walk you through that here in just a moment as well. And then also to let you know about some resources, training materials, guides that you will be able to see and absorb, which of course is our learning management system, the same place where you signed up for today's session. Going forward, even beyond today, I don't want you to think that you're not able to reach out or to ask any questions. We do have a dedicated email address, which is Ohio Training Team at Maximus.com, which is solely dedicated to answering any questions that you guys may have, whether that's about this new process, whether that's about how to sign up for additional sessions or future sessions, or to just provide any additional feedback or ask any additional questions. So we want to make sure that we make that available to you as well. In regards to a previous question, as far as submitting proof of payment to waive or to have a waiver request granted, I mean, I would think that you would actually need something that shows that you paid the fee, like a receipt, maybe some sort of document or bank statement or something. I don't know if there's a specific document, but if you're requesting a waiver, then I think you're actually going to need to provide something as a proof of payment. Um, that's actually the kind of how it's listed in P&M. Hopefully that answers that question. And even for the rest of you, I know that question wasn't asked publicly, but hopefully that answers that question for anyone that may have had that question. Another question, where do you link the Ohio ID numbers to groups and providers that you are the admin for? So you can do that initially in pre-registration, which again, if you've been to our sign on and setup session, which is more or less classified as session 1, this being session 2, then you would have noticed that you can do that there. Once you go live and you're in P&M, you can in P&M, I think it's the account administration button, which is where you would go to link those admins. Make sure I'm not missing anything? All right, I don't see any additional questions. Again, I don't want you to feel as if you have to stay, but I do want to quickly walk you through how to access um, the um, the evaluation. Let me go ahead and pull up. Actually, let me pull up Absorb really quickly. Give me just one moment. Let me move it over here. All right, and you guys should be able to see my Absorb. I'm going to go ahead and log in. Okay, so this is your Absorb dashboard, so to speak. Let's just, for the sake of argument, say that this is today's session. Okay, of course, my screen shows a lot more because I'm signed up for multiple sessions. But once you've signed up for a session and you've enrolled, you're going to see this view button. All you want to do is click that button to your session. And then on the right-hand side, it says evaluate course. Pretty easy to get to. I can't emphasize enough how important these evaluations will be for us going forward, which will not only help us to provide, hopefully, better training experience going forward, but that also includes more information about how you guys feel. We take any and all feedback, whether that's provided through the course evaluation, whether that's an email that is sent to us beyond today, also whether that's any of the information or questions that you guys have asked throughout today's sessions. We are compiling um, additional resources that will be available for you all going forward. Do see oh, that's not a question. Oh, thank you. Busy Bone said, thanks, Jerron. You've been great. Well, you guys have been awesome as well. Um, Let me put back up the other screen just so that you can see it in case anyone needs to jot down the email address. I'll go ahead and say thank you on behalf of the training team, Jamie, John, and myself. You guys appreciate your attentiveness. Please continue to send us any and all feedback. We really appreciate it. I can't stress it enough because it helps us help you guys. The more information we have from you, we can take it back to see if what can or cannot be done and how we need to move forward. The better we're able to answer questions for future uh, uh, people that decide to join our sessions. Again, we really appreciate it. And you guys enjoy the rest of your day. Don't forget, whenever you're ready, feel free at the bottom right-hand corner to hit leave. That will successfully take you out of today's session. You guys enjoy the remainder of your Tuesday and have a good night.